The Nurse Force for the Future, the APNA National Conference in Brisbane, and we're talking to primary healthcare nurses, and especially we're talking to Cathy Carrasco here, who was today announced as the Nurse of the Year, which is an amazing honour and a great tribute to your work. What does it mean to you?
Oh, it's huge. It's just it's sort of like a recognition of everything that we do, pretty much. And I don't think nurses really expect to get an award for work they do. It's just a job that you go and do, but yeah, we do a lot.
So a number of things about your work were highlighted today, in particular your focus on research, and you've led the clinic into some research projects. Can you describe them?
Yeah, there's a nurse-led research project that we've been involved in with flagging anxiety in over 75-year-olds. So we've been incorporating that into the over 75 health assessments, which I go and do those in people's homes. And it's a fabulous opportunity to build up relationships with patients and find out what sort of services they need at home. And I think it's very good for improving their health.
You talked earlier about it's a very different visit than having the patients come to the clinic.
Absolutely.
Why is that? What do you observe?
Well, the last clinic that I worked at a number of years ago, we used to do the health assessments within the clinic, and you know, people can present very well in the clinic and tell you pretty much what they want to. But going out into their homes, you can have a look in their fridge, see if they've got any food, see how clean their houses are, how they're sort of coping at home. You can see their relationships with their neighbours, so you see if they're lonely. There's a lot more that comes out by seeing people at home.
Now we'll get on to some of the issues more widely about for practice nurses or for primary healthcare nurses with many different names. But first we're going to meet Mary, who is from... Mary, could you introduce yourself?
I'm a nurse and I work for South East Melbourne PHN in Victoria. I'm part of the Healthcare Homes project.
And that's very interesting too. But you know Cathy's work well. Why would you say she has been so honoured today?
I think Cathy has been honoured because she strives to do her best, and her best is such a high standard that she's to be admired for that. She's always seeking out the latest knowledge, the latest support. She's really willing to come along to network meetings and support her colleagues and also learn from her colleagues, and that's such a great attribute to nursing and something Cathy should be really, really proud of.
Fantastic. Now I'm going to scroll back and get you both in. So we're going to talk about being a primary healthcare nurse, and what are the opportunities there. And it's good you mentioned healthcare homes because we had thought that would be. But what are the challenges? What are you sort of experiencing?
The challenges are time. There is so little time to do a massive amount of work, and I think people don't realise how much we actually do. Like, with immunising, wound care, so many things.
Supporting self-management,
yeah,
chronic disease advice, chronic disease support, coordinating care, as well as your day-to-day bread and butter stuff. Someone's advice on how to look after a child with an illness, giving someone advice on how to look after their mum with dementia, and so much stuff within every stage of every person's life. I say to people new to general practice as a nurse, I say, you remember what you did when you went to nursing school, you know, your 3 or 4 years of whatever training you did. When you go to general practice, you get to use every single one of those skills you learned in that period of time in one day. And then you'll go back the next day and use every single one of those skills again the next day. There's such a variety. Practice nurses need so much knowledge and are called on to do so many things, from organising someone's social outlet to organising wound care to looking after an emergency.
So how well supported then is that work? Because I think most of us in life now claim to be very busy at work. Is it just you're just busy, or are there structural problems around that busyness that need to be addressed?
Sometimes getting the support from your colleagues in general practice can be an interesting exercise.
In what way?
Sometimes they forget that you actually have the knowledge and skills to do all the things that come across your pathway. Sometimes they don't trust that you have the knowledge and skills to do that, or sometimes you don't trust yourself that you have the knowledge and skills to do what comes across your pathway as a practice nurse. So all three things impact on your scope, what you're able to do, and then there's the obvious problem of getting paid to do it.
So how do you get through that then, Cathy? Is that what you've been able to do?
Yes, well, I'm very lucky because the GPs that I do work for give me a lot of autonomy, and they have said to me, you know, take the job into the direction that you would like it to be. So they let me direct myself a lot.
So have you just got good GPs, or did you talk them around well?
Well, I've got good GPs, but they're also happy to be talked around. You know, just doing the health assessments at home, for example, was something that they never did, that I sort of brought into the clinic, and just a recall system with the care plans and diabetes, getting my own system with that. They're happy for me to do that. Yeah, so
getting that support makes a huge difference.
Absolutely.
I mean, you can learn everything you need to know to do it properly, and they get the positive results from that. The patients disclose more. It's well documented that patients disclose more to nurses. They feel comfortable disclosing things to nurses that they may not have disclosed for many years of seeing the same GP. They feel they have the time to talk to the nurses, which means you can sort out that a lady can't get to the shopping centre, which is why she doesn't have food, which is why she's not getting the blood test results that the doctors expect, or she can't get to the chemist to get her pharmacotherapy, so she's not taking a medication. The nurse can find time, usually, to help sort that out, and also realises that's the barrier, whereas sometimes the GPs don't have that time. So to have the trust of your GPs, as Cathy's got, to be able to run with it and do those things make a huge impact on the patient care, which means the GPs look good.
And how are healthcare homes working out for practice nurses?
It's really slow. It's really early days. I think people expected it to be a lot quicker uptake, but there's a lot of system changes. There's a lot of changes that need to take place at basic practice level, which just take time. People have to do change as they're ready. One of my colleagues says quite commonly, how do you eat an elephant? And the answer is one bite at a time. What people don't realise is that everyone's got a different sized bite, and as a practice facilitator, to do that change, you need to take that as at a practice pace. And unfortunately, the practice not only has healthcare homes happening in the practice, they've got their normal business happening alongside that. And so every practice is going to have a different rate of change. Having said that, some lovely stories coming out of GPs being really invigorated that patients who are enrolled in healthcare homes starting to take responsibility for their healthcare, which they haven't done in the past. A really good example of GPs seeing changes in patients because nurses are having the time to spend a little bit with the patients while the practice still gets the money they need to run the practice, and taking that little bit extra time with the patient to help make sure the patient understands the implications of their conditions, so that you can encourage that self-management in the patient.
But Cathy, as a final word, as the Nurse of the Year, we heard earlier that Health Minister Greg Hunt, his mother and his wife were nurses. We all know nurses, we all value nurses. What do nurses need from governments now?
What do we need from governments? You know what? It'd be really nice if we could bill directly to Medicare ourselves. And just have a bit more recognition that way, I think. That would be nice.